Hello, and welcome back to Ask Your Pain Doc. As you know, in this channel, we talk about traditional and alternative treatments for pain. Today, we're going to talk about something very different, the injection site pain. Do you hate needle? Do you hate injection? You better watch this video because I'm going to teach you some technique to reduce the injection pain. Make sure you subscribe to my channel and turn on notification. Let's do this. One of the most important things that is very crucial in terms of pain when you do an injection is the needle size. Sometimes you have a big needle and sometimes you have a tiny one with the tiny needle tip. Obviously, this is less painful for patients. However, sometimes we cannot inject big volumes through these small needles. These needles are usually are perfect for small injection, buttocks injection, or tiny insulin injection. So size of needle makes a big difference. One of the other factors that is very important in terms of pain at the injection size is the style of injection. A smooth and steady hand movement, not moving a lot, and basically going to the target and do the injection and remove the needle. That would be the ideal technique. Topical anesthetics. I'm a big fan of putting a lot of cream at the injection size before doing any type of injection. I'm sure if you had a child, you've seen it that sometimes when they do injection for young kids, they put a topical cream. This could be a mix of bupivacaine or lidocaine, and they leave that in that area about a couple of minutes, and then you can do the injection. The other technique that is very crucial, and I used it a lot during my practice, is use of cold. Sometimes you can put an ice pack around that area and make sure that area is super cold before do the injection. I really like this, what they call it, pain ease spray. This is a spray that basically frees that area. You have to leave it at least for 20 seconds before you do the first insertion. So you basically spray that area. Ooh, so cold. Just leave it for at least 20-30 seconds, and then you can do the injection. Using a pressure and vibration is also a great technique. I've seen some physicians that before they do any injections, they pinch the skin and they put that little bit pressure over the skin before they do the injection. I also love this oscillation or a vibration device that you can turn it on and it basically sends some deep vibration around the area that you're doing injections. And then this particular device, you can inject basically between the two heads. What I love about it is very easy. It's available everywhere, and it's very good if you want to do a couple of tiny injections. I use this a lot during trigger point injection in neck and shoulder, or during Botox injection. It's a great vibrating tool, and it's a great distraction to my patients. It's also good that as a practitioner and a physician to have a good bedside manner. Try to keep up your smile, talk to your patients, make sure when you talk to them, be pleasant, obviously. A good music and a nice lighting in your office, if possible, can make a huge difference. If patients listen to some music, he or she may feel more relaxed during that painful process. These are really small factors that I believe if you add them together can make an injection therapy not that unpleasant. medication or relaxation medicine. For very rare cases, some patients who had severe anxiety or severe phobia of seeing a doctor and they have not done that, sometimes I prescribe relaxing medicine like Valium or benzodiazepines. So you have to make sure you talk to your practitioner before you schedule. If you have severe phobia, those medication can make you a bit relaxed and sleepy. So you have to be cautious that you're not able to drive when you take this medication. But those medication can also be helpful if patients have severe phobia or anxiety. Also, a method of injection is very important. If you're doing an intravenous injection, obviously you have to have a certain type of angle when you insert. If you insert it in a very sharp or a very inappropriate angle, is going to be very painful. For intramuscular injection, basically a 90 degrees is appropriate. One of the other very important factors is the best injectors are slow injectors. You have to, when you get to that target area, you have to inject it very slowly rather than just push everything inside. By pushing that, it's kind of open up the soft tissue or the tissue around that, and it can cause some severe pain. So the best technique that I recommend is just to do the very, very slow injection. What we're going to do after the injection, applying of heat and cold around that area could be helpful. If it's a deep injection, sometimes massaging the area, just a light massage will be more than enough. It's also very important that when you're planning to receive an injection, you make sure you take your medication. If you're diabetic, make sure your blood glucose is under control. If you check your finger stick, and make sure you be hydrated enough so you don't feel dizzy or you don't feel nauseous after any type of injection. It is very important that you communicate with your doctor or the nurse or the practitioner if you had some bad experience before, and if you like specific type of treatments or modification, as I've explained to you, you should communicate properly to your practitioner so you're going to have the best experience. Thank you so much for watching these videos. Please send me your comments and feedback. I'm looking forward to see you all soon. Don't forget to subscribe to my channel and turn on notification. I'll see you all soon.